Hi, my name is Joni, and today I want to share with you a self-treatment technique that's useful for releasing what we call the dural tissue. Now, the dural tissue is a thick, fibrous casing that surrounds our spinal cord, inside our spinal column, and also reaches up and surrounds our entire brain. So when this dural tissue, or the casing around our spinal cord and brain, gets tight or restricted, it can cause pain, headaches, even migraines. So it's important to keep this tissue flexible and loose. So one of the best ways to address tightness through that dural system is by getting in a seated position similar to this, with your back supported against the wall. We're actually going to have you slide your bottom away from the wall just a couple inches, just so you're slouching just a bit. This is the only time that you're allowed to slouch. And then ever so gently and slightly, you're going to let your head drop forward towards your chest. And we're going to go very slowly and very slightly so that we can feel that exact moment of when our head position dropping forward starts to elicit that pull or stretch that we feel around our spinal cord and spinal column. So as we allow our head to drop forward, as soon as we feel that slight pull, stretch, or drag through our back or through our spinal cord, then we're going to maintain that position, holding right there, breathing into that tightness or breathing into that sense of stretch, and allowing that tissue to release. And sometimes it can take 4 to 5, sometimes even 6 minutes of holding in a particular position for the tissue to release and the fascial tissue to let go. So in order to get long-term results, we want to take good quality time with these positions and with these releases. It's important to go slow and to be gentle and easy and stay within the very subtle range. Anything that's too intense, it makes our body tense and brace against it, and our tissue cannot release, cannot soften, and can oftentimes actually aggravate different areas of our body if we're too aggressive and if we're too intense. So as we breathe into the sensations that we're feeling, and as we let our bodies soften, and we start to feel the releases happen, and you'll know when you're getting releases in your body because you'll feel the tension ease up, you'll feel the tightness start to go away, and you'll feel the pain start to dissipate. So when it feels soft, like there's no pull, no tension, then you can allow your head to drop forward just a bit and find the next position of tightness and repeat the same process. Now when you first start treating your dural tissue, you want to be very easy, gentle, and you also want to spend just a bit of time with it. So maybe the first couple times that you treat yourself using this technique, you may want to just explore 1 to 2 positions of tightness within each session. Over time, as your body becomes more soft, elongated, and flexible, and there's more fluidity in your fascial system, then you can stay with this technique a bit longer for multiple releases all within one session without aggravating things. Now when you finish with this technique, you want to return to that neutral position or the starting position very slowly and very gently. Just letting your head come back up into neutral, again slowly, so you don't want to trigger any rebound effect.